So guys, today on Hospital Vibes by Dr. BJ, I'm going to tackle antibiotic abuse. It's a very serious thing we should look at. So first of all, I'm just going to talk about what antibiotics is, and I'm going to be very plain as possible. Antibiotics are medications that are designed to cure or treat bacterial infections. Simple put, as somebody will say. So the abuse comes in when, let me just put a scenario here. A patient comes to my consulting room, I make a diagnosis of, let's say, urinary tract infection. And then I put the patient on antibiotic regimen, which is, let's say, cefuroxime, or one of the medications is cefuroxime, okay? People say different ways. I just want you to understand very, very clearly. So I give you cefuroxime 500 twice a day. You are supposed to take it in the morning and evening for 7 days. Now, you started taking the medication. After 2 days, you realize that maybe the infection is not gone yet, the way you haven't actually seen any changes yet. And then you take it upon yourself to add, because your mind tells you that the more you take the medication, the faster you're going to be treated. It doesn't work like that, guys. If you are being given a therapeutic dose means that if we say take 500 milligrams, that is the maximum dose you can take to combat that bacteria. Now, if you decide to double it, you're not going to achieve anything, but what you're going to get is side effect of the medication. It's only going to stress your liver and other organs unnecessarily. So guys, I entreat all of you, don't abuse antibiotics. Guys, also we have patients whose job is to interfere with their antibiotic regimen. So you've been diagnosed and put on antibiotics. The doctor has made it very crystal clear to you to take the medication twice daily, or once daily, or 3 times daily for 7 good days, continuous. And then you decide as a professor, or I don't know how to call you, decide to pause on the 3rd day because you have already seen improvement. It doesn't work like that. You are going to worsen your situation. What actually happens is that the bacteria would develop resistance to the antibiotics. And this means that the germs or the infection that you are treating would now even grow stronger and they will attack you well. Now, the antibiotics isn't going to work anymore when you take it because you interfered with its process and the bacteria develop resistance to it. My main kind of trick say, Ofa edro no doctor ama wedro o yare waba when your bacterial infection the ama wedro doctor ninim and ode oto so say pneumonia we a wenya no fa edro we for 7 days. Minuamo 7 days no said o se fa na nu pepepe na se ofa. Untumi mfa ne said e wo pe no. After 3 days, you say cough now started subsiding and I cough from now say we want to marry no want to dia kanego. Minim say wa wo hwe me when we say one kasa de wo ye no we di wo bone. You have to stop. Ujaya is going to affect you. Bacteria no ebe develop resistant to antibiotics no. Next time I'll be fan no enye adwuma. Nti won say yema wedro bia na wo honto. Now you put your blame on the physician. Doctor na enye hwe. Wan kasa waso odin nti me pacho munjai.